Hi, my name is Angelina Viola, and I'm going to be presenting on tick-borne encephalitis in Russia. So I just wanted to address the most prominent diseases in Russia, and I'm choosing encephalitis because it's the most common infectious disease, most specifically tick-borne encephalitis. However, the leading cause of death in Russia is actually chronic heart disease, and some other diseases to note are HIV and AIDS and tuberculosis, which are also prominent. So tick-borne encephalitis is a viral infection that causes swelling of the brain. And the last quarter of the 20th century marks unprecedented increase of TBE, and there are currently 11,000 cases annually in Russia. Russia also has the longest history of suffering from TBE, as it was originally isolated from the Far Eastern region in 1937. So some symptoms can just be flu-like. You can get a fever, aches, nausea, vomiting, but some symptoms can be neurological, including the swelling of the brain and spinal cord, confusion, difficulty speaking, seizures, and eventually even death. So there's no treatment or medication for TBE, but there is a vaccine. So the spread of this disease, you obviously contract it from ticks, but you can occasionally get the infection from consuming unpasteurized milk from goats, cows, or sheep. Um, and there's no direct person-to-person transmission, obviously, it's just vector-borne. So prevention for this disease is to wear appropriate clothing, especially while outdoors, and to avoid consuming unpasteurized milk and obviously using vaccines. In areas that are highly endemic, the HWO or WHO recommends that vaccination be offered to all age groups, including children. So some of the socioeconomic factors that I want to address are geographic region of living, gender and age, occupation and recreation, education, income level, and there are a couple other risk factors that we're going to address a little bit later, but these are just the first couple. So geographic area of living, tick parasites obviously inhabit primarily forests, therefore living near a forest area increases the incidences of TBE indirectly. Gender, occupation, and recreation. So there's actually a higher prevalence of TBE among men than women, and this is possibly related to exposure of outdoor activities. So men usually do more work outdoors or are more recreationally active outdoors. So this is the thought as to why men are seen to have more instances. And there's also a lower risk perception of TBE among men than women. Education and income. Now, this one is interesting because highly educated people were seen to be more equipped with personal prevention and knowledge about TBE. However, those with higher income and jobs usually lived in these non-endemic areas and would have more time and energy to actually travel to these endemic or more foresty areas to have recreation, go camping, hiking, etc., and be exposed to ticks. Now, I don't know if you remember in the past, but the endemic regions are usually vaccinated while non-endemic regions are not. So people from these non-endemic regions who are not vaccinated travel to these endemic regions and get bit and actually have a higher prevalence, higher instance to contract the disease. Whereas people who actually live in these areas and are vaccinated, there's less of a prevalence there. So some other risk factors I want to address are urbanization, the environmental factors, age, and then vaccination coverage. So urbanization, the urban expansion accelerated the landscape fragmentation and actually makes ticks from suburbs invade city parks and greenlands, which increase human exposure to ticks, boosting the number of TBE infections in urban populations. And then the most, I think, important factor to address are these environmental factors. So endemic areas are widespread across the southern part of the non-tropical forest belt, which is right here. And there's currently 48 regions that are considered to be endemic as is 2019. So TB infection is also increasing with higher rainfall and higher temperatures. And so climatic changes are contributing to this evolution that enlarges the tick population and shifts their distribution northward and toward higher altitudes. So ticks require a temperature of about 7 degrees Celsius and a humidity above 85% to reproduce. And so recent global temperature increases um, have been increasing the area in which TBE can be found in Russia. So due to the climatic changes, there have been projections to increase in mountainous areas, especially an increase in northern Russia as well. So not only does the climate affect tick activity, it also affects human activity. So there are more people traveling in these warmer summer months, and they'll travel into these endemic areas without being aware of the risks, also bringing up that incidence level. And then there's also an increased mobility of humans that adds a heightened exposure as outdoor activities and international travelers are on the rise, as I have said. So actually those over the age of 50 are thought to be the most active outdoors because they're told they need to get outside for their health and they're retired now or close to being retired, so they have more free time on their hands. And they're actually at higher risk of disease manifestation because they're more immunocompromised, their immune system is not as good in their older age, and they're also going outside more. It makes sense as to why the most common age to see TBE in is then 45 to 40 years old. Another important factor is vaccine coverage. TBE is preventable, however, vaccine coverage remains low in many countries, including Russia. Um, Russia vaccination coverage differs slightly between different regions, so it depends. And the reason for these differences, I wasn't super sure on this, but it says that the reason for these differences is though vaccinations are carried out in these endemic districts, the level of vaccination actually calculated across the region as a whole. Um, so yeah. And then the goals for prevention, I found this article saying that only high immunization rates can ensure low disease rates in the long run. So to achieve this goal, we need more public education and to raise more awareness. And under the present conditions, the strategy of TBE control should be to radically revise it toward mass vaccination of populations living in those highly endemic areas, which should drastically reduce the morbidity of the country. So the current barriers to reduce disease is that many Russians actually don't want to get vaccinated. And this has to do with one, the 1998 Andrew Wakefield article, which links the MMR vaccine to autism, which has been disproven, but there's still suspicions there. And there was also an article published in 1988 saying, well, you think it's only a prick. And this was published and in rotation to the number was 22 million people, and it's just went through the dangers of these dirty mass vaccinations developed by these criminal pharmacologists. Eventually, this spread through the Russian Orthodox churches, and vaccination rates of this year plummeted and never actually fully recovered. And then, as in many other places, access to care in rural areas of the country is very difficult. With severe climates and the severe winters, it's even worse in Russia, since sometimes airlift is the only way for you to get access to medical care. And so private health insurance policies are actually preferable for these rural areas of Russia. And usually people don't have, vaccines on their mind when they're going to get airlifted out somewhere. So it's usually for a much more urgent issue, and people are often forgetting these routine checkups, which is another reason we're seeing an increase incidence in Russia of this TBE. Another common practice in Russia is actually to consult alternative medicine before and after seeing a biomedical practitioner. So official stats often also say that Russia has more alternative practitioners than regularly licensed doctors. This is affecting the rates of vaccinations and also the practices of using antivirals and antibiotics. Thank you. That's all I have for you today on this, and I look forward to hearing your questions in class.